Good, thank you. How you been?
That camera there, okay?
Going good.
My name's Dominic and I've had gout for 11 years.
Is gout easily treatable? I'm Sally Dooley. I'm a GP in Melbourne and I've been practising as a GP for about 25 years.
My name is Vority. I've had gout for over 30 years.
Do you have any joint damage from gout? Ready? My name is Robin and I've had gout for about 3.5 years.
Have you ever felt uncomfortable or embarrassed telling people you have gout? Hi, my name's Adam and I've been suffering with gout for 28 years. I was 21 years of age when I got diagnosed the first time.
How should patients manage flare-ups? I'm David Liu. I'm a rheumatologist and clinical pharmacologist in Melbourne.
My name's Alex.
This is camera.
I had my first flare-up probably 5 to 6 years ago.
Describe the pain you experienced during a gout flare. Bloody terrible.
The way I describe it to people is you ever hit your thumb with a hammer or jam your finger in a car door, that initial throb you get, it just stays for days and days and days, throbbing like that.
When you first get gout, you'd think that there's something dreadfully wrong because of the pain. Everything seems to be difficult. The pain's awful.
The pain was very excruciating. It's similar to walking on glass. You could barely handle having bed sheets on your feet as well when you're experiencing the pain.
The pain was very excruciating. Sometimes you couldn't even put your foot down and it really stopped you from walking.
Gout's a condition caused by uric acid, going right throughout the body, but especially in joints, forming crystals. And what happens when people get flares of gout is those crystals create inflammation and create a lot of pain and heat and swelling at those joints. But it can affect right throughout the body.
It can actually affect all joints. The most common joint is the base of your big toe, and a lot of people would be familiar with that. But you can get it certainly in knees, in women, for example, where it's more likely that it'll occur in sort of small joints in their hands and multiple joints.
It can be partially because the body's creating more uric acid, or partially because the body's not able to get rid of as much uric acid. Is it true big drinkers mostly suffer from gout?
It's just the myth that these people think that you're an alcoholic if you've got gout. That's the worst part. I haven't drunk for at least 50 years. No, I don't drink.
Gout only affects men is not true. Both men and women get gout, perhaps men a bit more than women though.
Gout only affects overweight or obese people. That's a myth. I've definitely got plenty of patients who have gout but aren't overweight or obese.
Gout is a result of a poor diet is also not true. Some dietary factors may make it more likely for people to get an episode, but it's not the cause of the gout itself.
A lot of it's really baked into genetics, and I think that's one really sad thing, that people try and blame people with gout for having gout, but in reality a lot of it's just in our genes and we can't get around that.
When I was younger, I had heard a lot of stories of people suffering gout, and they were mainly those ones that did overindulge in drink, alcohol, and excesses such as, lifestyles and what have you. But I now know that that's not applicable to everyone.
21. Back then I was pretty fit, definitely wasn't an unhealthy lifestyle.
In my culture, across all Pacific Island nations, basically it is seen as shame as having gout and taking medications. It is seen as a sign of weakness. For myself, initially in the beginning, I refused to take medication. Therefore, I was experiencing more gout flare-ups. I wore it as a badge of honour as having a gout flare-up. But now, I do take the medication more regularly.
I always talk to my patients who do come with gout about that they don't have to have those particular risk factors in order to get gout. It doesn't have to be because their diet's bad or they drink alcohol. Genetic susceptibility is considered the most likely reason people get gout in the first place.
Have you felt stigmatised because you have gout?
I think there is a stigma around having gout. Certainly for myself, I did feel a bit awkward mentioning it. If there was more prying, then maybe I'd say I've got gout and they probably would think, he drinks too much. And that's not something that you want people to think about you.
Because of the stigma attached to it, the association of excessive lifestyles and what have you, yes, you'd say you've got arthritis instead of gout.
I've definitely felt stigmatised, because I got diagnosed so young.
People say, oh, you're walking, what's wrong with your feet? And I said, I don't have very good feet and all this. Oh, they'd say, oh, you've got arthritis. And I'd say, oh, yes, and leave it. I would never say the word gout.
I think people with gout are stigmatised because I think there's very much a general perception that it is all about people not looking after themselves, and I think there's a perception that it's because they drink too much and eat the wrong foods and that's why they've got gout, not that this is a medical condition that's part of their sort of genetic makeup and it's not really caused by that. That's just a contributing factor.
When you first experienced gout, what were your first symptoms?
Woke up in the middle of the night, swollen, heat. Then obviously went and got the blood test and the uric acid levels confirmed that, they were raised, and from that day on I've had gout.
The final diagnosis came when I had some fluid taken from the ankle, and then when I saw the specialist, the rheumatologist, I did go for a blood sample and that pathology came back conclusive, that it was gout.
Gout's not necessarily an easy thing to diagnose. At its best, you take a bit of fluid from inside the joint and look at it underneath a microscope and see those uric acid crystals. But often it's about trying to put together what's happened to someone with gout and trying to understand. Often we use blood tests to help that diagnosis. One of the key ones is serum uric acid. That's looking at the uric acid in the blood, which gives us an idea about how much uric acid is in the body altogether.
Initially, I did think it would only last up to a year or two and things would go away. Over time, I do realise it is a lifetime illness.
I didn't know it was a lifelong disease. I just thought it was just like a sprained ankle. It'll go away and you'll be right next week. Probably at first I didn't get that told to me. It was after, the flare up 2, flare up 3, and then it was like, you've got this for life.
Gout is usually a lifelong condition, and that's usually because the factors that contribute to someone having gout persist right throughout.
Did you know gout can be managed with medication?
We know that gout can really get packaged up with a whole lot of other conditions in the metabolic syndrome, like heart disease, like kidney disease as well. And so it really becomes this perfect storm of problems that treating gout can help.
You can't get rid of gout, but you can certainly manage it very well.
One of the things that I wish more people knew about is that gout is very treatable and that can really turn around lives when we start to treat it. It's really about trying to reduce down the amount of that causative chemical, the uric acid. If we can reduce that down in the bloodstream, then we can really turn the whole disease around and stop flares from happening and stop the damage and the further problems from happening too.
It's just a matter of getting the right medication and monitoring in place.
The group of medicines that we use as a cornerstone of treatment are called the uric acid lowering agents. We usually start them slowly and gradually increase them so we can avoid the risk of any allergies to them. And when we do that, they're very safe.
I continuously and religiously take it every day because it's not too much of a problem. It's only the one tablet a day for, the rest of my life. If that's all I have to put up with, I'm a lucky man.
Yes, I do take urate lowering medication on a daily basis, and this keeps the flare-ups at bay.
The incidence of the gout flare-ups that I used to get are no longer there, and there's no side effects.
Since I've been on it, it's been really, really good. I don't have any side effects at all. My uric acid levels have dropped immensely, and I'm feeling very good about it.
The main uric acid lowering therapy that we use does help with reducing down risk of heart attacks and strokes. So beyond just the gout, there's really even more of a reason for us to try and look at these medicines.
Have you been tempted to go off your medication when you haven't had a flare-up for a while?
I have tried to go off the medications and ceased it for a period of time. However, I've noticed that I do experience flare-ups when I do this. I think it's best to take the medications continuously on an ongoing basis.
I've been told that it never will completely leave my body.
The specialist told me you'll be on this medication for the rest of your life, which my response was, what? I'm not old enough to be on tablets every day. However, it was explained it's a simple one tablet, there's not many side effects from it, or if any, and it will manage your gout.
I'd virtually say to anyone about to jump off their medication because they haven't had an attack, stay on it because, more than likely you are going to get one and it'll be quite severe.
One of the tricky things is that when people are better, they feel like, perhaps I can stop it. But really the idea is that they stay on those medications for life.
The same factors that are causing gout in the first place are usually still there, things like genetics. So it's the kind of thing that we usually continue on right throughout the lifespan.
The role of the GP in managing gout is crucial, so both in helping make the diagnosis, managing those acute flares, but particularly in the ongoing monitoring, so organising those regular early blood tests, reviewing patients' symptoms and their results, and ensuring that they're on the appropriate dose of treatment long term. When I'm starting people on gout medication, we try and check their uric acid every month so we can adjust their medication dosing. Once people are stable on their medication, we might stretch that out to, say, 6 monthly, and if they're very stable, we might do it once a year.
I do get my urate levels checked every 2 to 3 months. They're tracking within normal limits at the moment, so I'm pretty happy with that.
6 monthly, I have I go and give a blood sample for pathology and see my specialist. It's been going well, yeah.
What are the consequences if gout is left untreated?
Gout untreated can lead to pretty substantive damage to the joints, to the way that we use our joints. And I've seen people who haven't had their gout well controlled and they've had to live with the consequences of damage to their joints. That's, of course, before you even think about the effect of gout on the rest of the body.
I've got joint damage in my toes and hand.
Yes, I do have a bit of joint damage in the feet as well there, so that is being managed, and I do see other allied health specialists that do help me.
The damage I've got in my joints, my ankles and knees is irreversible, yeah. It's the cards I've been dealt and, just obviously taking the medication correctly, prevent those flare-ups, and less flare-ups means less joint damage.
How should patients manage flare-ups?
If I look at my patients who are on good doses of uric acid lowering therapy, they rarely, if ever, get flares. It's possible, but instead of being an everyday occurrence, it's something which is really rare.
When I have a flare, I just take my normal medication plus another one until the flare subsides.
I still get flares every now and then. Just have that care plan and just, take the medications that you need to get through that. I take a couple of, tablets to treat the flare-up and then also continue my normal medication.
The key thing about managing flare-ups is that the sooner we deal with them, the better. We've got good medicines now to treat flares of gout. When flares come, it's important that not only do we treat the flare, but we don't stop the uric acid lowering therapy as well. So we just need to continue both medicines during that flare until we get out to the other side.
If you do get a flare-up, you can manage it now with the medication that's available, and that I have found very helpful.
In terms of trying to treat gout with diet or natural therapies, while there are a lot of things that can help a very small amount, rarely are they enough to try and turn things around once you've had an actual flare of gout. So really, once that happens, it's about trying to get rid of the chemical, the uric acid, and medicines are by far and away the most effective in doing that.
I did try to manage gout with diet, but then when it was still flaring up, you need to go and seek other specialist sort of advice.
Do you have any triggers that bring on a flare-up of your condition?
There are certainly foods like tomato that can trigger it off, and seafood, red meat. Alcohol is a bigger contributor than all of those things, and certainly some alcohol like beer is probably worse. Well, they're all purine-rich foods, and that purine becomes uric acid. So it's a chemical that gets broken down into the chemical that causes gout. But those really, in terms of magnitude, are much smaller than genetics.
With the flare-ups, it was a combination of eating the wrong foods and drinking the wrong drinks. The foods including spinach and tomatoes, seafood.
I'm a big fish eater and any seafood, and that's the worst thing I could have been eating.
All types of seafoods as well as breads.
If I ate a lot of, protein-based foods, I'd get a flare-up, or obviously some seafood.
If we go along with the ideal treatment for gout, if we stay on the medicines and do all the other right things, we can prevent damage to the joints, we can prevent the damage that gout does to other parts of the body as well. It's the kind of thing that makes us simply live longer.
The medication actually does do the significant part of the work for people who really want to prevent episodes and reduce long-term risk to their joints. Regarding lifestyle, look, certainly that helps to manage things better, and the sorts of things we encourage people are aiming to be a healthy weight as they can manage, modify or reduce their alcohol intake if that's relevant, and to be mindful about the amount of some of those foods that we know are triggers like meat and seafood. It doesn't mean they can't have those things, but they just maybe want to think about having them in a more moderate amount rather than in high volumes.
My advice to people who've just been diagnosed with gout or just experiencing gout for the first time is that be reassured that you can do something about this. If you're proactive about it and you take the right medicine and we put together the right management plan, this is something that doesn't need to get in the way of life.
I don't think there's anything a gout patient can't do.
So I've got patients living with gout who you wouldn't know have gout and are able to live completely normal lives.
At the moment now, I am able to function a lot better now, with the gout being under more control, a lot better.
Managing my gout into the future for me is just keep taking the urate lowering medications and just stay active, I suppose.
Staying on the medication indefinitely is my plan right now. I don't want to have another flare-up, and I don't want to have, serious joint damage or internal organ damage.
I'm very glad that I had it diagnosed, that I've got a treatment plan in place with the right medication. I have been following that religiously, and as a result of that, I'm very comfortable about where I am and how I feel about managing the gout.
It doesn't stop me from doing anything. If I want to do something, I do it.
You wouldn't know I have gout. I wouldn't know that I have gout.